Jason here with Samba Scientific. Thanks for tuning in to our Friday Spotlight interview. Today we're talking with Angie Purvis. She's a CLIA lab director based here in Colorado. Angie, I guess in terms of just, getting to know you a little bit, can you introduce yourself to our viewers?
Sure, absolutely. My name is Angie Purvis. I am a PhD in biochemistry. I started my career as an undergraduate at Center College in Kentucky. I did a bachelor's degree in biology, and then I went on to do a PhD in biochemistry at Washington University in St. Louis at the medical school. And now I'm a laboratory director and a regulatory consultant in the diagnostic space, both on the CLIA side and on the in vitro diagnostic side, working with FDA.
Oh, terrific. So in the context, I guess, of today's discussion, really we're talking about infectious disease. Can you talk a little bit about maybe how you got started working in infectious disease?
Yeah, absolutely. So I was interested in infectious disease kind of across my education, but I didn't actually come to infectious disease from a career perspective until a little later. I was actually working in the diagnostic space, and there were several opportunities, to either build laboratories or to work on in vitro diagnostics. So I pursued both kind of at the same time. And that led me into infectious disease. I've worked on a lot of pathogens that impact the developing world, as well as some of them that impact us here in the United States and more westernized countries.
Oh, terrific. So big question, I guess, when I think about the bottlenecks of testing, and this is sort of something that I'm hearing a lot about, and I just, immediately kind of think of all the state universities, all the research universities that have microbiology departments, coming out of the lab, right, to be able to, extract RNA from plasma samples, to be able to run qPCR assays. It seems kind of trivial, like basic molecular biology research. So I guess the big question I have is, can we simply solve the testing bottleneck, as it were, by, opening up these research labs to start doing COVID testing within the university setting?
So, in theory, yes, because there is some expertise there from a technique perspective, and the infrastructure is there as well. One of the problems, though, is ensuring quality. So there are some differences running, an RT-PCR assay or other assay in a research setting as opposed to a diagnostic setting. The regulatory body for the laboratory-based diagnostics is called CLIA, and they have pretty strict regulations pertaining to what quality of diagnostic testing looks like. One of the potential risks, of course, is a false positive result from contamination, because research labs don't always adhere to the same level of containment and cleanliness as the rigorous diagnostic labs. So in theory, it's doable, but there are some limitations just looking at what's required from a regulatory perspective and patient safety perspective.
Gotcha. So during this time of social distancing and sort of lockdown, obviously, CLIA labs would be a necessary and a vital sort of industry that would need to continue. But have you been working in person with some of the labs, I guess, that are trying to get testing up and going, or is this being done remotely?
So it's a combination of both, at least from my perspective. So I do help laboratories either build from the ground up to become diagnostic labs. And I've been doing that in the COVID testing space very recently. So early on, I was, very boots on the ground, helping to build the necessary infrastructure and to ensure that, containment systems are adequate and technicians are protected and tests are set up in a reasonable way and that they're properly validated. It's good that I started that work early on because now I am working almost exclusively remotely, And I'm using, these remote technologies for video conferencing to do essentially tours of laboratories and, training sessions with technicians and other things that make it look like I'm on site and feel more like I'm on site than just a phone call. So it's a combination, really. There are some challenges.
Yeah, I bet. So you mentioned that you've done work in the developing world. Can you tell us a little bit, I guess, about similar remote work that you might have done in the past?
Yeah, absolutely. So during the 2014-2015 Ebola outbreak in West Africa, I was highly involved with several groups that were working on in vitro diagnostics to, help with surveillance, disease detection, and some sort of very early technologies to look at progression of disease prediction, so kind of a prognostic for those for that situation. That's probably, that was the most interesting. There's also been, a recent outbreak of Yersinia pestis in Madagascar, and I've done a little bit of work, to do some PCR-based assays for detecting that organism as well. But Ebola was probably the most notable.
Gotcha. Um, so when you're setting up a lab, I mean, so again, let's at least to humor me, imagine that we had a microbiology lab, people that technically know what they're doing.
Right.
What sort of approach, I guess, would you take in terms of trying to implement, ultimately, convert that to sort of more of a CLIA or clinical testing laboratory? How do you approach that in general?
Yeah, so there are, essentially four phases to that, and they follow, the framework of the CLIA regulation. So first, you have to think about, especially in this particular situation, containment. Containment means a couple of things. So there's containment of the organism and the preliminary specimen to make for sure that the technicians and the environment's protected from contamination. So, ensuring that safety precautions are in place and rigorously adhered to is number one in my mind as a laboratory director. There's also containment downstream during the analytic phase when you start to look at, the amplification process. So you can have, nucleic acids that can other specimens, and that can lead to false positive results. And that can be extremely problematic for the patient and, for a pandemic situation like this. So containment's one thing that I always think about first when, we're in a infectious disease situation. The second phase is under CLIA regulations referred to as the pre-analytic phase. And that essentially considers all the processes involved from collection from the patient all the way until that specimen is received by the laboratory. And when I think about that, it's putting procedures, processes in place to ensure that those specimens are high quality and of good integrity to protect patient safety. Again, that's where my mind always goes. If you have a compromised sample, then you run a risk of a false negative potentially. So after the pre-analytic phase, there's the analytic phase. And there needs to be, procedures in place that are established, that are validated too. All of these processes have to be validated prior to, setting up your lab, saying you have a diagnostic in place in your laboratory. And then there is also the post-analytic phase. And the post-analytic is reporting. So in this situation, getting the right result to the patient in a very timely manner is critical to ensure that patients don't continue to come into contact with others and potentially cause a furthering of the pandemic. And in the case of COVID-19, there's the EUA through the FDA to notify that you are doing testing. That's a very important piece of this. That's a little different for CLIA labs. This is really a unique environment for diagnostic testing labs to have to, interact with the FDA in this way. Fortunately, it's a pretty streamlined process, and the application is very straightforward. It does not take a lot of time to fill those out.
So, I mean, beginning to end, what is it, how long does it take to do this, like to stand a lab up, for example?
So once the space has been identified, you can quickly do this in, working very hard. I would say 3 to 4 weeks is probably what's required. Especially if you work with somebody that has done it in the past, and you are running a test that has already been established and approved under the EUA by the FDA. There you can run into some technical glitches, so it's can take a little longer in some cases, but I would say 3 to 4 weeks is a reasonable time, including any setbacks you may have.
Yeah.
Yeah.
Um, I I guess one thing that kind of comes to mind is that, especially right now, like there's an urgency to sort of, increase testing throughput. I can imagine, and maybe you can speak to, I guess, just the number of new labs that have sort of been popping up or that you've been working with. I mean, just in terms of scope, 2020 versus any other year. Have there been I mean, are you seeing a huge bubble, you know what I mean, in terms of new spaces and new testing centers?
I would say yes. I routinely build laboratories or stand up new testing lines for labs, and I do I don't know, 5 or 6 maybe within 6 months, so perhaps one a month, let's say. And it's been incredible, the number of groups I've worked with for just COVID-19. There are still some other diagnostics that are of interest that people are working actively on, but the majority of what I'm doing right now is in COVID-19, and so that's kind of an interesting shift. There's still some work in oncology, some cardiovascular work I'm doing, but it seems like just about everything is dominated, at least by COVID-19 for
Yeah,
today, anyway.
I could totally see that. Um,
Yeah.
so as part of standing these labs up, I guess, I mean, what sort of obstacles, um, I mean, have you seen or with the EUA and the FDA and the government, like, are things actually more streamlined than they used to be?
I would say yes. I would say that in general, I mean, having a template for the EUA filing is kind of demystifying the process for laboratories. The fact that there are some pretty solid tests out there that are on the market for sale under the EUA also makes things go much, much smoother. A laboratory can, purchase one of those tests, validate it for their laboratory, and that's much easier than developing a test or kit from scratch for your own laboratory. So I would say, in general, this is it's a fairly straightforward process. I won't say that it's 100% glitch free to go from empty lab space to up and rolling CLIA lab. There are some hurdles there, but if you have space and you know how to do PCR testing and you are a diagnostic lab, putting this one in place is it's not insurmountable at this time, is what I would say.
Gotcha.
Yeah.
Have you, so one of the things, I guess, with the different companies that we work with, we've been hearing about kind of supply chain disruption. Have you experienced this, I guess, firsthand or groups that you work with?
Yeah, I have, unfortunately. So supply chain management is really not my specialty. However, because I have worked with, and I am working with several labs in this space, and there is significant risk to the technical staff who are running these tests. I feel like kind of an unsung hero within this within the medical community for COVID-19, but those clinical lab technicians need masks. They need, gloves, PPE in general. And I have run into, requests from laboratories to help find PPE, and also to find, nucleic acid purification materials. Some of the raw materials, at least early on, were in short supply. I sense that things are improving a little bit. At least I'm getting, less requests for that. So I feel like the supply chain may be stabilizing a little bit, or I may just be optimistic, but that's my hope anyway. And just looking at, the number of requests I'm getting are beginning to decrease significantly than they were 3 or 4 weeks ago, let's say.
Gotcha. So I guess when you think about, and not necessarily, I guess, realizing how involved you are with sort of diagnostic device development, but when you think about, solving testing from both, we need more tests on one hand, we need more people running those tests on the other hand.
Yeah.
I mean, what do you think, how is there going to be a happy ending to this? Like, what has to happen? What needs to be falling in place, for the sort of, testing, frequency, so people can go back to work and sort of, have some peace of mind at the very least?
Yeah, that's a great question. So I feel like there are a lot of questions here that the research community can make a significant contribution on, in terms of once you've had the disease, what's the rate for someone to catch it again? In terms of environmental transmission, what's the frequency and how much viral load is required in that scenario? So I feel like there are a lot of fundamental questions still needing a lot better data to support. In terms of, frequency of tests, I feel like many of the laboratories right now, a lot of the diagnostics is kind of dominated by the RT-PCR variety, the molecular tests. And those are great. They tell you in real time, do you have the test? But once we understand, what the host immunity looks like over time, after you've had disease, what we'll really need are good antibody tests. And that, the research will tell us, what the value of those tests will be, and how frequently people will need to be tested. And, all of that on the diagnostic side, without mentioning, of course, that a vaccine is really what we need in order to come out of the pandemic. But that's, a ways in the future, I would say.
Gotcha.
Yeah.
So what can we do to help? As a scientific marketing firm, I guess, as sort of scientists that are probably viewing this right now, what can individuals do at this point if they're not in the lab?
Yeah, that's a great question. So if you're not working in a diagnostic testing lab, thinking about the supply chain question previously, in 3 or 4 weeks ago, when there was a really bad supply chain problem, I was getting contacts from sort of the biotech resources within each state. So for example, here in Colorado, we have the Colorado Bioscience Association. So those types of organizations were reaching out to me and to others in the diagnostic community, asking, do you have masks? Do you have gloves, other, PPE or other critical supplies? If your laboratory has those, you might want to get connected with somebody in the diagnostic space so that you can potentially make donations when that becomes important again. Or, even more optimistically, if it becomes important, maybe we're past that broken supply chain problem. That's the hope, but time will tell.
Well, good. Well, I guess that's all I have for you today. Thank you so much for your time.
Yes, thank you.
And to our viewers as well, thanks for tuning in. Have a great weekend.
Thanks.